Well, good morning. This is an historic event for Oregon. It is also a very personally significant event for me. I've spent 25 years of my adult life working on creating a better healthcare system here in Oregon. The Oregon Health Plan was something that I've helped to create and to improve over the last 2 decades of my public service. My vision and the vision of the people in this room is that Oregon can and will have a better healthcare system that actually improves the health of our citizens at a much lower cost. A healthcare system that truly works for all of us, for the young, for the elderly, for everybody in between, regardless of their color, regardless of their income, regardless of their home language. That shared vision is our goal, our North Star, and today we are taking a significant step to achieve that vision. I want to just acknowledge a few people here. There was a lot of folks involved in getting us to this point. I'd like to first thank the Oregon Health Policy Board, Vice Chair Lillian Shirley, who's with us today, Chair Eric Parsons, who is unable to be here today, and I know there's some other members of the board joining us. I'd like to thank a number of legislators, Senator Alan Bates, who unfortunately is in Seattle with his mother today, who has had some illness. Senator Lori Montes Anderson, Representative Kotek, Representative Tim Freeman, Representative Mitch Greenlake. These people were champions of this process from the start. They have worked tirelessly day in and day out, given hundreds of hours, long night meetings to actually put this legislation together. I'd like to thank my health policy advisor, Mike Bonetto. I can't say enough about the role that Mike has played. He's been the glue that's held this process together, and I'm very grateful to him, to Sean Colmer, and particularly their families who have given us so much of their time. Hopefully you'll be reunited with them at some moment soon. I want to thank the staff at the Oregon Health Authority, Dr. Goldberg for his leadership, Tina Edlund, Judy Moore-Peterson, and others. An amazing job and something that you should all be very proud of. And finally, I want to thank the presiding officers. President Courtney, Co-Speaker Hannah, Co-Speaker Representative Hannah's right back there, Arnie Roblin, for their patience, for their persistence, and their hard work to put together an amazing bipartisan coalition, 18 to 12 vote in the Senate, 53 to 7 in the House. Truly remarkable. Finally, I want to just comment quickly on the public process. It's been quite remarkable. We've had over 75 public meetings or tribal consultations around the state, 8 community meetings, a very impressive effort, and it shows the spirit of Oregonians coming together to solve a shared problem. And we'll be continuing that process of public engagement. You can go to www.health.oregon.gov to continue to participate in that process. I think it was our shared recognition of this problem that allowed us to create a shared solution. As you know, the cost of health care is a growing burden for individuals, for families, and for businesses. It is eroding our ability to take our precious public resources and invest it in children and in families and in education. It affects every part of our economy. But by focusing on prevention and wellness, by focusing on community-based management of chronic conditions, by better coordinating care, we can create a healthcare system that actually produces health, that can improve the health of our population and save us millions, if not billions of dollars that can be reinvested in things like education and other social priorities. Today we set out on a path to do exactly that, to create a system here in Oregon that will be good for our people, that will be good for our state budget, and that will be good for our businesses. I'm going to give you just one quick example of how things will look different under this legislation. Becky Wilkinson, where is Becky? Becky Wilkinson is not a doctor, is not a nurse, but plays a very critical role in our healthcare system. She works with individuals who are frequent visitors at the emergency room, people who use the ED sometimes as much as once a week. And a project, and what she does is she gets together with those people and she connects them with community-based primary care. And over in Bend, a project she worked on in Bend with 144 individuals who were in and out of the emergency room. She reduced their ER visits by 49% in just 6 months, making them a whole lot healthier and saving hundreds of thousands of dollars. But under our current financing mechanism, there is no code to support somebody like Becky in our healthcare system. We've got 9,000 different billing codes through which doctors and hospitals get paid. There's no code for prevention. There's no code for wellness. There's no code for health improvement. Yesterday, 1 week after we passed this legislation, we have requested waivers from the federal government to give us the flexibility to support the work that Becky does and other kinds of innovations that are actually focused in keeping people healthy and out of the acute care system. We've also asked the federal government for a significant investment in federal funds to help us make this transition to a new delivery model. As you know, the potential savings here are enormous. Over the next 5 years in state and federal funds, the estimated savings are in the neighborhood of $3 billion, which we hope through our 10-year budgeting process we can then reinvest in other parts of our budget. So over the next few months, we're going to be putting together the last details, and our hope is that we will push the start button on July 1st and have CCOs up and running across the state of Oregon. Let me just finally say that this moment is Oregon at its best. A huge bipartisan group of legislators and individuals who've come together to do the right thing for our state and for our children. George Bernard Shaw once said that some men see things as they are and ask why. Others dream things that never were and ask why not. That's us, here today, and I have never, ever been prouder to be an Oregonian. Nice to have a long name.
You got it.
Congratulations.